Hi guys, quick video about dealing with results cases, audiograms, x-rays, blood tests, spirometries, who knows, it could be anything. Either you've requested them in primary care and they're coming back to you to see the result, or they've been requested in secondary care and you're getting a copy of the results and you're supposed to give them to the patient. A couple of key things to think about when you approach these cases, just to get your mindset clear. I'm Arora, I'm a GP and an educator based in the West Midlands. Hopefully this is going to help. Let's start. Now, one of the first things that I get asked at our course when we do a results case is, when should we give the result? Is it right at the beginning of the case when the patient comes and says, "Doctor, what do the results show?" Or is it towards the end of data gathering when you've done your bits first, you've got your information, you understand a bit more about what's going on? Now, the first thing to say is there's no right or wrong, and it depends a little bit on the patient, which we'll talk about in a second. But if I get the choice, if I have an option, I want to do what makes it easier for me first. So I want to get some information under my belt. I want to find out what's going on. I want to find out what the symptoms are. I want to go through the story. I want to make sure nothing's changed since when they came in last time, because those results might mean something different now that the situation has changed. So if the patient is calm and chilled out and allows me to do that kind of stuff, I'm going to do my data gathering first, and then when I give the results later, I've got a bit of context, I understand, I'm ready for the questions. Imagine this: a patient comes in and they say, "Doctor, what happened with the test?" And you tell them, "Oh, everything was normal." Now, what's the first question that patient's going to ask? "Oh, so what does that mean, doctor?" Or, "Is it serious?" Or, "What's the treatment?" Or, how am I going to manage this? Now, how do you know what to do if you haven't understood it yourself first? So if I get the chance, I'm going to always do my data gathering first, and then when I give the results, there's a bit of clarity in my mind and I have answers for those questions. Now, it doesn't mean to say that's always the case, not a rigid rule. So if you get a patient coming in and you start asking them questions, they start to show visible signs of anxiety, looking at the screen, trying to find the results, looking at their watch, showing that they're annoyed, that they've been through this kind of stuff before. Don't just stick to the idea that I've got to do my questions first. You change, you adapt, and you say something like, "Oh, Mr. X, look, normally we'd ask a few questions first just to see how things are, but look, I can see you're really anxious. Let's maybe go to the results first." That's fine. That's a cue you've picked up on and you've dealt with it there and then. But if you get a chance, if the patient's quite relaxed and they're quite chilled out, don't just go in and give the information straight away, because you're going to find difficulty in answering those questions and you're going to have to go and do data gathering anyway. So if you get a chance, my preference is to get the data out first, understand the situation, make sure it's clear in your mind, and then give the results, unless there are strong cues from the patient that they really want these results now. Now, imagine this: you get a whole set of blood results coming through to you. Full blood count, U&Es, LFTs, TFTs, lipids, everything's there. And there's one blood test that sticks out. U&Es perhaps, shows they're in severe renal failure, for example. Now, what does our mind do? Our mind goes straight to that blood test. So when the patient comes and says, "Doctor, what were the results?" we sometimes jump straight to that blood test. "Oh, I'm really sorry to say, but your kidney function wasn't quite right." Now, from then on, the whole case revolves around kidney function. There's no way you're going to be able to go back and say, "Oh, but don't worry, your blood count was normal, your TFTs are normal, your LFTs are normal." They don't care about this at that point. Their mind is gone. Your mind is sucked towards that discussion. So what we'd always say is start with the normal results first. If you get a whole list of stuff, say to them, "Actually, really good news, quite a few things are normal here. Your blood count, your LFTs, your lipids, your thyroid function test, your cholesterol, all those things are bang on normal. But there is one that actually has come back a little bit abnormal, and I think we should have a little bit of a chat about that." Much easier, because at least you've got the good stuff out of the way. You've given something, you've covered that bit. Because if you go with the negative stuff first, it's very difficult to go back and talk about anything that's normal, because the patient's mind is lost and is going to ask you so many questions about kidneys, renal failure, what does that mean, dialysis, etc., and then you're down this path that's very difficult to come back to. So if you get a whole set of results, start with the normal ones first, focus on what's okay, what's good, what's right, and then at the end, come on to the abnormal ones, and you'll find it much easier to manage. Now, really good tip about actually giving results, a practical tip about giving results. Now, what we often do when we get a whole set of blood tests, or we get a long x-ray report, or we look at an audiogram, for example, a picture of a graph, we tend to keep it to ourselves. So say the patient's sitting over here, we're kind of like this. So we've got the results and we're like, "So your blood count was normal, your liver function test was normal, your kidneys were normal, your thyroid gland was normal, but actually there's a little bit of a problem here with this lipid result." Now, straight away, the patient is struggling because they've got no focus. You're looking down half the time. They don't know where to look. The connection's gone. The rapport is affected. Interpersonal stuff is all affected by little things like this. Because remember, you're trying to make a dialogue with this patient. You don't want to lose that connection. So make sure you have a focal point. Right, so make sure you and they are looking at the same point when you're giving results, and make it so much easier to follow, and it flows a bit better. So say the patient's sitting here again, turn it towards them. Right, so Mr. X, as you can see, we've got a whole load of blood test results here. Your blood count was spot on normal, so that's really good. Your liver function test actually was really good as well, so they're working fine. Your kidneys look like they're working really well, but actually there's one that I'm a little bit more concerned about, is your thyroid blood test. Now, as you can see, the normal range for thyroid blood test should be these, but actually yours is a little bit high, and I think that's something that we need to have a little bit of a chat about. Now, straight away, my eyes are maintaining focus on the patient much more than looking at the screen, because I can kind of see out the side of my eye and I know where I'm looking. They're looking at the same place, so when you highlight it, it makes it much easier to give the results than when you're talking and you're hiding things in front of you. So whether you get results on a card or whether you get results on an iPad or a screen, make sure you try and give a focal point to the patient so both eyes are on the same point. It'll just seem better, it'll flow better, you'll find it much easier to give results than when you're hiding it to yourself like this. Now, a really quick point about Breaking Bad News. Now, the majority of our Breaking Bad News stuff is on our main Breaking Bad News video, but this is just a little bit here because this is a results case and it is quite relevant. So say you get a patient where you're suspecting cancer here. So they've got a report from a biopsy, or they've got an x-ray report or something that tells you this is probable or suspected cancer. Now, when you talk about Breaking Bad News traditionally, there's two things that I think are really important. Number one, have a buffer in place. Don't just go straight for the word cancer because you hit them too hard, obviously. And number two, don't have too long of an approach up to the word cancer and break bad news at a snail's pace because nothing gets done in the end. So say, for example, you get this x-ray report that shows a shadow on the lung. Now, you could go in all blasé, so look, at Mr. X, I haven't even sat down yet, but I'm really sorry to say this may be something like cancer. Okay, obviously that's going to hit them really hard, they're going to be shocked, there's no buffer, and you're going to find it quite difficult to catch that up because the patient sometimes will be quite obviously lost in their thoughts and worried about things. However, what we can do sometimes is take it to the extreme of the opposite side, and we just max out this Breaking Bad News, and we have kind of 17 steps before you hit the word cancer. Oh, this might be something a little bit to worry about. Oh gosh, something's been found on the x-ray. Oh, this something can be quite serious. Oh, it could be like a little shadow. A shadow could mean something quite serious, and maybe it's like this could be like a tumor, and a tumor by I mean cancer. Okay, the bell might have gone 2 minutes ago. Okay, so you haven't even got the most important words out. So it's a balance. You don't go in and throw the word Breaking Bad News at them, but you don't hide the Breaking Bad News for 3.5 minutes. So something like best case scenario, worst case scenario works quite well for things like cancer or generally Breaking Bad News. So say you get this shadow on the x-ray, or you get, for example, you examined a lump and you found a lump down below, for example, in a young male patient. You sit them down and say, look, yes, we found a lump, you're absolutely right, I'm really glad you come to see me about this. Now, there's lots of causes for lumps in teenagers or people of your age down below. Best case scenario, it could be something like a cyst. We see a lot of those, they're not too worried, and nothing we need to do about those things. But when we get lumps like this, we just need to make sure we're not missing what we call the worst case scenario here. Now, by that, I mean things like a cancer. So straight away, I put that buffer in. I've not hit them with cancer straight away, but also I've not taken these 16, 17 steps to hit the word cancer. So best case scenario, worst case scenario can work very well. It's something that you've got to try. You've got to work out your own Breaking Bad News tactics. And I say, look at our main video for some more of these, but just go with these two principles. Don't go in straight away with the Breaking Bad News and tell them straight away and hit them quite hard. But secondly, on the other extreme, don't spend too long getting up to Breaking Bad News because you've got a lot to do once you've actually broken that news in the first place. So guys, hopefully that's been of some use to you. Hopefully you can take those 4 things into account when you practice in your study groups, when you practice giving results in real life. So remember, don't go to the results story if you don't have to. Always start with the normal stuff first. Have a focal point for both you and the patient. And remember those tips about Breaking Bad News. Now, if you found it useful and you think there's other things that might benefit you from our CSA videos, have a look. We try and pick up those key areas that people either ask us about in our courses or generally find quite tricky when it comes to CSA preparation. So have a look at those, subscribe if you found it useful. If you have any other videos you want me to make in terms of CSA, AKT, anything to do with GP training or PLAB, just let me know and I'll be happy to make those videos. There's a long list of requests that tend to come in, which is quite nice, quite helpful. If you want to come to one of our free CSA masterclasses in the evenings, or if you want to come to one of our full one-day CSA courses, please have a look at the website. All our dates are on there. But if you're preparing for CSA and you've got it in the next couple of weeks or months, I'm sure it'll be absolutely fantastic. Good luck, and I'll speak to you and hopefully see you at some point soon. Bye-bye.